Well, welcome everyone to our fourth virtual advocacy days to discuss the impact of COVID-19 on our community and some of the drastic economic challenges we face ahead. This is part of a 6-week series discussing impending budget challenges with some of our key state legislators. And today we welcome Senator Christine Rolfes from the 23rd Legislative District. And we welcome Senator Andy Billig from the 3rd Legislative District. Senator Billig let us know that he's been asked to join a call with the governor's office this morning, and he will be on just a little bit late. So in his stead will be his legislative assistant, Noelle Connolly. We're very excited to chat with them today. My name is Stacy Dim, and I'm the executive director of the ARC of Washington State. And I'm co-hosting this event today with the Washington State Developmental Disabilities Council and with Self Advocates and Leadership, or SALE. We appreciate that you're all here today, and we just remind you to be respectful of each other's feelings, backgrounds, and differences in language or ability to communicate. Please enjoy all the different perspectives today. Always assume good intentions with our fellow Zoomers and with our fellow legislators. And remember, it takes great courage to share our stories. So let's be sure to support each other. I'm excited about this opportunity. I know it's going to be a good discussion. And now I'd like to turn things over to Jessica Renner just briefly to share some tips about interacting on this platform here today. Jessica?
Good morning, everyone. My name is Jessica Renner and I live in the 33rd Legislative District. I am an advocate as well as the Advocacy Coordinator for Self Advocates in Leadership SALE. I will be your Self Advocate co-host alongside the ARC of Washington State and the Washington State Developmental Disabilities Council for this virtual Advocacy Day 6-week series. There are a few things you need to know before we get started. First, everyone will be muted at the beginning of the webinar. Second, I would like to remind everyone that we are also live streaming these virtual advocacy days on our Facebook page at www.facebook.com/thearcofwashingtonstate. Third, we are also recording each week's presentation and will post the recorded sessions on our website at www.arcwa.org. Fourth, if any of the participants today want to welcome the guests or talk to other attendees, please use the chat box. If you have questions, you can type them in the Q&A box or raise your hand using the icon. Click on the raise hand icon to ask a question, or to post a question. Type it in the Q&A box by clicking the Q&A icon located next to the chat icon in the middle of your toolbar. If you raise your hand, we will unmute you when we call your name. Then you can unmute yourself using the microphone icon on the bottom left side of your toolbar. This will allow you to ask your question. The raise hand icon is located on the bottom right corner under the More option. Please note as a reminder, please hold your questions until later in the program, when we will answer questions posted in the Q&A. If you need clarification on something, post it in the chat box and someone will try to address it. Finally, I want to ask where people are from. Please type what county you are from in the chat box with that. I'll turn it back over to Stacy to continue on with our program.
Thanks, Jessica. I'd like to begin with some introductions to provide just a little information about the organizations that are hosting this event today. I'll start with me, just get that out of the way. The ARC is a national organization, and it promotes and protects the human and civil rights of people with intellectual and developmental disabilities, ensuring their full inclusion and participation in all aspects of our community. We have 8 local county chapters across Washington, and we've been around since 1936. The ARC is known for pioneering innovative programs and services for people with intellectual and developmental disabilities, and making sure that society understands the enduring potential and inherent value of people with intellectual and developmental disabilities. Now I'll turn it over to Jeremy Norton-Paul with the Washington State Developmental Disabilities Council.
Yes, good morning. Thank you, Stacy. My name is Jeremy Norton-Paul, and I am the Executive Director of the Washington State Developmental Disabilities Council. I live in the 27th Legislative District, and I work in the 22nd Legislative District. And just a few quick things about the Developmental Disabilities Council for those of you who may not be familiar with us. We are federally funded, and we get our mission and mandate from a federal law. There are 56 councils across the country, one in every state and territory, and we all look a little different. But here in Washington, a big piece of what we do is around advocacy. Put simply, our job is to advocate for people with developmental disabilities and their families all across the state. And we do that in a few key ways. One of them is that we work on ways to change the system to work better for people, whether that's working with policies and laws or working with our partners at various state agencies. Another way that we do that is we help people advocate for themselves and the people that they care about. And we also provide a variety of information and resources so that people understand how the system works, how supports and services work, and how they can navigate a system that is often very confusing. One of the unique things I think you should know about our council is that all of our council members are appointed by the governor to represent various areas of the state. And so that changes year to year which areas are represented, but it ranges from Spokane and Colville to Walla Walla, Tacoma, Seattle, Gig Harbor, Trout Lake, all across the state. And so that's just a little bit about the DD Council, where I'm happy to talk with you more about our council's work at a later point. But I'm going to turn it over real quickly to Adrian Stewart, who is our Public Policy Director, to introduce herself.
Hi, everyone. My name is Adrian. I also live in the 27th Legislative District, and I am a proud parent and a sibling to 2 amazing people with developmental disabilities. So I'm honored to be a part of this work. I love doing it both for personal and professional reasons. So I look forward to talking with you a little bit later about how you can get involved and stay involved in our advocacy and education efforts statewide. So thanks for being here.
Thanks, Adrian. And then Emily, you want to go ahead and introduce yourself and SAIL?
Self-Advocates in Leadership. SAIL is a statewide coalition in Washington state of people with developmental disabilities. The SAIL coalition strives with legislative advocacy to shape public policies that affect the lives of people with developmental disabilities. SAIL meets the second Tuesday of the month on Zoom from 1 to 4. SAIL, along with the ARC of Washington and the DDC, hosts Advocacy Days each year. SAIL puts together their own legislative priorities and one-pagers each year on the issues that SAIL members think are the most important to share with legislators during the legislative session.
Thank you, Jessica. I'm Diana Stadden. I'm with the ARC of Washington State also, and I'm the Policy and Advocacy Coordinator. And at this point in the program, we would like to introduce our legislators. We'll start with Senator Christine Rolfes. Would you introduce yourself and maybe say a little bit about what you do?
Sure. Thank you for having me today. Thank you, Diana. My name is Christine Rolfes. I am the state senator for the 23rd Legislative District, which is North and Central Kitsap County. So Bremerton, Paulsbo, Silverdale, Bainbridge Island. If you're familiar with the Seattle area, it is the communities that are served by the ferries from Seattle and Edmonds. So we're a peninsula surrounded by water. I've been in the Senate for since 2011, and I've been in the legislature for 13 years. So I am one of the more senior members of the state Senate at this point, not in age, but in years in the legislature. And since 2018, I have served as the chair of the Ways and Means Committee. So that's the budget committee. That's a really big job. So I serve on that committee, as well as most recently the Natural Resources, Agriculture and Water and Parks Committee, the Natural Resources Committee essentially. And my area is some of the things that I have focused on since I've been in the legislature have been on K-12 education and helping the legislature to resolve the McCleary lawsuit to amply fund the public schools. And over the last couple of years, we've been amping up our funding for special education as we have gotten more details about what the districts need and how they've been spending that money. And so that's one of the remaining details that we needed to take care of before COVID hit. Now, of course, the entire K-12 system has been upended, and we are working on how to cobble education together for all the kids of the state at the same time that parents need help getting back to work. So that's our big education challenge right now. Other issues I've been very involved with are related to the ferry system and transportation, military families and veterans, and small business development and support for our main streets. So that's just a little bit about me. I have 2 kids. My husband and I live on Bainbridge Island, and our daughters are now 19 and 21. So they are out of the house, but not out of our lives. And I think, is that enough of an introduction, Diana?
Yes, that's great. Thank you. So the other person we're going to introduce later would be Senator Andy Billig, but he couldn't join us right away. And so Noelle Connolly is his executive legislative assistant, and she's agreed to join us in his place until he can arrive. Would you like to introduce yourself?
Sure. My name is Noelle Connolly. I am born and raised in Spokane, and I work for Senator Andy Billig, who is the 3rd Legislative District Senator here in Spokane. He is also the Senate Majority Leader. So that has been for the last year, almost 2 years now. So he's kind of got his hands in a lot of different issues, but yes, he also serves on not just the Rules Committee, but also on Ways and Means with Senator Rolfes, and is involved in a lot of those budget negotiations that she was talking about, and including McCleary. So I am happy to be here and listen to everyone's Q&A. I'm, Senator Billig sends his apologies for not being able to join earlier. He has this regular meeting that he couldn't move, unfortunately, but he will be joining us very soon. So I am here to listen and pass on the comments from the discussion to him later when I have a chance to brief him. So thanks for having me.
Thank you, Noelle, and thank you, Senator Rolfes. Okay, we're going to start with a little poll here, and we want to find out who is here in what role. Oops, wrong poll. Sorry about that. We'll get the first one here. And so what role are you here as a self-advocate, as a family member, service provider, a policymaker, or maybe you're just an ally of people with developmental disabilities. So we'll give everybody a minute or so to put in what you do, what you are here as today. It looks like we got a lot of family members as well as service providers and allies to the DD community. And of course, we have a couple policymakers here as well. Okay, it looks like everybody is done polling at this point. So looks like service providers, we have actually quite a few. And I know that, you know, those have been some very big areas that are in need of funding is our service providers, because people with intellectual and developmental disabilities depend on them for so much in their lives, especially now during the pandemic. Okay, and so we're going to move on to some information from here. And I am going to call on Jeremy again and let him talk about one of the slides with you.
Thank you, Diana. And so as Diana changes that slide and we continue with this conversation, one of the most important things for us to understand is how developmental disability services and supports are funded and where they're found. And so first, a lot of us tend to think of developmental disability services as primarily coming from the Developmental Disabilities Administration, DDA. In fact, there are some of us who might initially think, well, that's where all of them come from, because so much of our focus and conversations tend to be about DDA. And that is absolutely right in the sense that a lot of important supports do come from DDA. But this slide summarizes how the supports and services that people with developmental disabilities and their families rely on to live and to live full meaningful lives come from a variety of places. And so I won't read all of these different places to you, but you'll get a sense of the scope and the breadth of all of these different agencies, ranging from a variety of areas of the Department of Social and Health Services, including DDA and ALTSA, and Division of Vocational Rehabilitation, all the way to the Department of Children, Youth and Families, OSPI, the Healthcare Authority, Department of Health. You'll see that some of these services, the ones that are in solid boxes, are directly provided to people with developmental disabilities and their families. Other services and supports in dashed boxes are more generally available, but are utilized by many people with developmental disabilities and their families. So one of the most important messages here is that when there are cuts or possible cuts to agencies across the board, it doesn't just hurt people with developmental disabilities and their families in one area or one agency or one department. It is hurtful in many aspects across this whole spectrum. And so that's one of the important things to recognize about how people with DD and their families receive support. And another important thing to remember is that many of those services that are provided, state funding, also have what's called a federal match, which means that for every dollar that the state invests, there is approximately another dollar that is invested from the federal government, which means that any cut that happens to a service like that is essentially a double cut, and we feel it doubly. It's doubly hurtful when it happens. And so that's another important thing to remember about many of these cuts. And if we don't make those investments as a state, then we don't receive the federal match investment either. So when you have more time and you'll listen to this recording, you can spend more time looking at these different departments, but that's a little bit of information I wanted to provide as we move forward.
Thanks, Jeremy. And Diana, if you could pull up the next slide. It's sometimes helpful to go over just for a minute what the Developmental Disabilities Administration biennial budget is in our state. And as you can see, it's about $1.8 billion in general state funds. And as Jeremy mentioned, we have that essential federal match, which is about another $1.86 billion in federal funds. Out of an estimated about 120,000 people with developmental disabilities in our state, there are about 50,000 people actually enrolled with the DDA. So they're eligible for, they're identified as developmentally disabled. Only about 35,000 of those individuals receive at least one paid service. However, and about 14,000 people wait for services. So they're eligible for, they've asked for services, they've asked for help, but they're not receiving anything. And again, overall, that's only about 1/3 of the people that we would expect to see and we are providing services to in our system. Just a reminder that our Developmental Disability Service Administration does not provide any housing, and generally it does not provide any crisis or emergency services in our state. In the slide that Jeremy had, we probably should include the Department of Commerce that demonstrates that housing, by and large, for people that live in the community, also comes from that administration. So we have a graph here to the left that shows the dollars and percent spent on each program provided by DDA. And as you can see, most of the funds are spent on community residential services. That includes services like group homes or supported living, other residential services through home and community-based waivers. And you can see that about an equal amount is in-home supports through home and community-based waivers. That includes respite and other kinds of therapies and services that individuals would get from one of our waivers. And then you can see there are about 13% of our budget is spent on RHCs or state institutions. We have about 67 individuals that are ready to leave our RHCs or institutions, but there's no community placement available. And then overall, we have 551 long-term residents in our RHCs. A couple of recent numbers I like to share. There are about 7 people right now who are stuck in hospitals that are waiting for community-based services, and about 53 eligible individuals through DDA that are stuck in psychiatric facilities. And then we have about 256 eligible clients in nursing facilities that are separate from RHCs who could also benefit from community-based services. So that's just a brief overview. Diana, we want to go on to the next slide. Sorry, that's me too. And so what we have here are some proposed cuts from the Developmental Disabilities Administration. Certainly you can see that some of the largest changes would come from reducing eligibility. So we're serving fewer people by changing the eligibility criteria. It's one of the main cuts that our administration has put forth. Again, we're looking at about $140 million in proposed cuts, which would translate to about $280 million total if you add in that federal match. We have 5 home and community-based waivers, and essentially the cuts would include not allowing any new placements. Respite hours would be reduced, and there would be no children's enhanced respite beds or crisis stabilization. And it includes a 1.8% cut to the rate in supported living from the 2020 session. In addition, we know that it includes cuts to rates to adult family homes. There would be rates and cuts to staff to transition clients to hospitals, from hospitals back into the community, and a 5% rate reduction for individual and group supported employment. And Jessica's going to share with you some additional cuts.
The residential habilitation centers are scheduled to take some cuts too. Self-advocates are happy to see that Renner will close and that consolidation of cottages will happen at Fircrest, Lakeland Village, and Yakima, but the state will keep state-operated living alternatives to move the RHC residents into. There are also services for people with IDD under other agencies, adding more to the 15% cut in DDA. The Health Care Authority is where some of the Medicaid optional services are scheduled to be cut, such as physicals, dental, therapies, interpreter services, and the dentist link for Medicaid patients. Additionally, Aging and Long-Term Services Administration will have eligibility changes and will eliminate adult day health and adult day care, as well as eliminating meaningful day programs in residential programs. the Department of Health will make cuts to neurodevelopmental centers for birth to 3 providers.
Thank you, Jessica. Okay, so we're now going to listen to a few of the constituents that have agreed to join us today. We have some parents and self-advocates, and we'll start with District 23. And Kelly Nesbitt is a parent from that district. And so she would like to share how these cuts would affect her and her family.
Hi, I'm new to this, so bear with me. I'm Kelly Nesbitt. I am from the 23rd Legislative District. I'm a family disability advocate and a mom to a 28-year-old young man and a 35-year-old young woman who is off living her own life. The 29-year-old is our son Ryan, who still resides at home. First of all, I'd like to thank you for the opportunity to be here and to speak to our experience. So Ryan is on a Basic Plus waiver and has been for quite some time, and he utilizes multiple services on that waiver. He utilizes the employment, he utilizes the respite. The respite is a big issue in our home. That to attend day programs and also to attend camps. And those 2 programs have really impacted Ryan and his independence and provided him with an opportunity to be more independent. And so the COVID has really showed us what our life could be like with these cuts. Ryan was very fortunate, he had a full and engaged life with employment, with day programs, attended speech therapy, which was paid for through the waiver services, obtained a communication device through waiver services. So there's a lot of things that we rely on waiver services for. And that all came to a full stop with COVID. Fortunately for Ryan, we've been able to restart his employment. He is willing to wear a mask, and he has a one-on-one job coach that stays with him all the time that helps him with the social distance issues. So what we're looking at, is right now he has a 6-hour-a-week schedule, even with the employment, because the other day program services are not available to us. And if they go away, this is a preview of what his life could look like. Ryan has experienced regression with some of his independence and an increased need for personal care services. And that also places a lot more stress on us as a family and myself as a parent provider. And if cuts are made, there's a lot of families, a lot of parent providers are going to have to go out and work outside the home again, adding more stress. So there's great concern for a lot of these issues. I would hope that things that would be looked at are the individual's needs. It's supposed to be about the individual and their needs, and how to mesh the service providers and all of that together. And also, are there other options that we can look at? There's barriers to some of these programs because personal care is not available, and a lot of the higher level needs folks need personal care. So sometimes things like employment and the day programs, community engagement, community guide, those things aren't options because of services that might not be available. So I would hope that we look at the cost effectiveness of some of the programs as well. And of course, the main hope would be there would be no cuts. But rather than just across the board cuts, I would hope that everybody's voice is heard and we can all work on this together. Thank you for the opportunity.
Well, thank you so much, Kelly. We appreciate your sharing your story. We're not quite sure what happened with Jennifer. She hasn't joined us as yet. And so we're going to hear next from Justin Maxwell, and he's a self-advocate in the 23rd Legislative District. So Justin, do you want to tell us how these type of cuts would affect you? You need to unmute your microphone. There you go.
Oh, hello guys. I'm Justin Maxwell, and I have a few words that I wanted to say about the budget cuts, and I think that it would affect me and it would affect everyone else in my community, because if we did that, it would make it so that we can live the life that we want to live, and it would cause, I don't know what to say. I'm nervous, sorry. And it would make it so that things would be taken away from us, like income housing and such as that, and would lower down the money percentage. Am I making any sense?
Yes, you're doing great, Justin.
Okay, thank you. And I don't want to see that happen. I don't want to see that happen to me, happen to my community, happen to, and I don't want to see the parents or get worried and nervous and upset, and them to be worried that something bad is going to happen to their child because they have special needs, and if we do budget cuts, it's going to hurt us. It's going to hurt them too, hurt the family, hurt the people that love them and care for them. And I'm going to help them. Yeah, I did. Because I want this to, how do I say it? I want the budget cuts not to happen because of the life that we want to live. The life that our parents want to say, you know what? I don't want my child going through hardship. Am I making sense, guys?
Yes, that's really good, Justin. So let's give Senator Rolfes a few minutes to address some of these things that Kelly and Justin have talked about. Senator Rolfes.
I think I'm unmuted. Am I unmuted?
Yes, you're fine.
Sorry to be sloppy with that. I want to thank Kelly and Justin for representing a lot of people, not just in the 23rd, but across the state, and hear the concerns. The cuts that were presented, the potential cuts that were presented, were put forth by DSHS at the request of the governor's office, so that the agencies would start to talk about and plan for reduced budgets in the coming years. So each of the agencies put out kind of a proposal for, well, here's where we would get cuts, here's where we would reduce spending, this is how we would do it. My hope is that rather than going through that rough exercise, hopefully 15% is more than we'll have to be looking at. But we're not gonna, the legislature's not going to, we're not likely to say, okay, 15% across every agency. We're much more likely to have a more focused approach to how to reduce costs across the entire state, across all state agencies, in order to get to a balanced budget. So I think that I'm hoping that what you're looking at is a worst case scenario. I also know that the budget for DDA has been there's been sort of a bipartisan caretaking of it over the years and a rebuilding of it, where both parties have really focused on making sure that the most vulnerable in our state are not hurt by the economic crisis. So I guess I'm trying to alleviate some fear that these conversations that you're having around the state are really helpful. It's really useful for legislators to get this level of detail. I haven't even seen this level of detail, and I'm the budget writer, mostly because we're not coming back until the fall at the earliest, possibly not until January. So because everything's changing so quickly, the legislature hasn't dived into the details of budget reductions, because we may not need to make reductions as deeply as it appeared in April. So I guess I'll just wrap that up by saying that I appreciate seeing the presentation and getting the details of what the agency was proposing. And I appreciate hearing how all of this would impact families and individuals. And I'm keenly aware of the need to protect people who are benefiting from the safety net in the most vulnerable ways. So I'm happy to answer questions. I don't have anything specific to tell you, but I'm hopeful that agencies are looking more at things like changing their lease agreements, because we don't have as many people going to offices right now, postponing technology improvements, or negotiating better deals with software designers, holding off on hiring when people retire, things like that can help us make up some of the revenue gap without hurting the people that rely on state services.
Thank you, Senator Rolfes. I guess one of the things that we sometimes get concerned about is developmental disability services usually are the ones taking the hit. Human services are. We know that we've got like 2/3 of the budget that can't be touched. And so then it comes to this small portion that can be. We know there's also money sitting in the rainy day fund, not enough to cover the whole gap, obviously. And as we continue to go on, that gap is likely to get bigger, especially with the way COVID is right now. And we have such a skyrocketing number of cases throughout our state. And so the resources for hospitals and for businesses, individuals who can't go to work anymore, those things are all going to kind of pile up to make this hole even bigger. So is the legislature looking at any ways to try and fill this hole? Because it's huge. We know that not just a few things are going to be able to fill that gap. It's going to have to be some pretty big things, which is why the first one on the list for DDA was to cut eligibility. And by doing that they said thousands of people will lose their services. And we've got, so many sitting on the no paid services caseload right now. We don't want to continue to add to that by kicking a lot of people off. And it's just going to make a lot of crisis in our community. Is the legislature working on any ideas to try and have something big to address this with?
Yeah, we are. We are working right now. The gap, as you said, for this year is over $4 billion. We have, as you said, Diana, $3 billion in reserves through the rainy day fund and through unspent resources that we set aside in March in anticipation of a recession. We didn't set aside enough. Nobody anticipated, I think, the economic impacts of this pandemic accurately. We set aside $200 million to address it, and that has been woefully inadequate, but it seemed like a lot of money when we did that in March. in any case, we have a gap. And as I said, we have $3 billion in reserve. So I would expect that the rainy day fund will be used to bolster services to avoid cuts, because that's what a rainy day fund is for. And then we are talking about how we could realign the current tax system so that we take some tax burden off middle-class families and low-income folks, and ask the wealthy in our state to pay a little bit more. So things like the capital gains tax will be back on the table. We're looking at some of the B&O tax loopholes and whether it's intelligent to close those loopholes during an economic downturn. Like which levers can we pull that won't negatively impact the economy? So we are looking at that. But I just want to say, even if we pass the capital gains tax and close some of the loopholes, it would likely be a year before that revenue came in, and it wouldn't, there's no tax that we can pass in the legislative session, either in a special session or in January, that will make up that gap. So we're gonna, I've been telling people around the state, everything is on the table. Support for revenue will certainly help keep the safety net intact. But we are going to have to look at service reductions, and where we do that is that's what we're looking at right now.
Well, thank you so much, and we hope you'll stay with us because we're going to have some question and answer time in a little bit. But first, we want to hear from Senator Billig's constituents in District 3, and so Jane Moody is a parent. And she would like to share a little bit with Noel for right now until Senator Billig's able to join us. Jane?
Good morning. Good morning. Thank you for the opportunity to speak with you today about the 15% cuts the Developmental Disabilities Administration has been asked to prepare to make. As the parent of a young woman with Down syndrome, I'm deeply concerned that these cuts will be disproportionately harmful to some of the most vulnerable of Washington's citizens, individuals with developmental disabilities. Most, as was mentioned earlier, most of the state funding for the services my daughter Joy and others with developmental disabilities need is matched by federal funds, so the cuts DDA is being asked to make are actually closer to 30% than 15%. My daughter Joy and many others depend on Community First Choice to provide the personal care hours they need to be able to remain in their own homes rather than in an intermediate care facility for individuals with intellectual disabilities or a residential rehabilitation center. It is not only their right to remain in their own homes, it also makes fiscal sense, since, as you know, it is significantly more expensive in the long run to care for someone with a developmental disability in a state-funded facility. Furthermore, the tightening of the eligibility requirements for DDA services will mean that Joy and/or her friends risk losing not only personal care hours, but important respite hours as well. Funding for employment, community inclusion, and community center access are all at risk. As a taxpayer, I certainly understand that cuts need to be made when revenues decrease, but these services make an enormous quality of life difference in the lives of those who depend on them, and they should be preserved if there's any way to make that happen. I think many of you probably remember a recent time when an effort was made to save money at the expense of vulnerable citizens like Joy and others with developmental disabilities. The state ended up being sued, and money that should have gone to provide needed services was wasted on legal fees. We need to avoid this by finding a way to work together to preserve services necessary to the welfare of our citizens with developmental disabilities. I am an individual provider with SEIU 775, as well as a parent provider. As a reluctant member of the SEIU 775 union, I believe that the contract between the state and our union needs to be renegotiated, because those of us who are members of SEIU 775 are in a much better position to take on some necessary budget cuts than are the vulnerable adults whom we are paid to serve. As a parent provider, I feel like I have very little voice in what my union stands for, and I know that my perspective is certainly not shared by union leadership. Nevertheless, I think it's important to note that the union was first formed in 2003 to address a genuine need for reform in the way family providers were being compensated. I'm thankful that the union did bring about that reform, but I feel strongly that the union has gone far beyond their mandate to negotiate a fair wage for family caregivers. The wages and benefits that have been demanded by the union and the ridiculously wasteful continuing education requirement they have forced Washington taxpayers to fund through a deceptively written initiative may well be unsustainable even in times of economic prosperity. There could be no justification for this kind of wastefulness when the clients we are paid to care for are facing losing services as essential as having a roof over their heads. I believe the contract with the union should be renegotiated. First, the requirement for 12 hours of largely irrelevant training each year should be replaced with a program that targets training to where it is specifically needed. Second, a negotiated contract with the union should include those of us who are caregivers agreeing to voluntarily take a temporary cut in our pay rate and an increase in our share of the cost of benefits in order to help prevent catastrophic cuts to services needed by our clients with developmental disabilities. I know very well that neither I nor the many children and adults with developmental disabilities have the political clout that SEIU 775 has. Still, I respectfully ask you to serve the best interest of those citizens most in need of your care, rather than to allow SEIU 775 to continue to bully their way into bankrupting the state of Washington with their incessant demands for higher wages and better benefits. SEIU 775 members must be brought to realize that in this time of limited resources, we must accept our responsibility to put the needs of those we serve above our own. Thank you for listening to my point of view.
Well, thank you for sharing, Jane. And although Senator Billig isn't with us yet, I'm sure he'll be able to go back and watch the video. And we also have a self-advocate from the 3rd District, Robert Ashby. Would you like to say a few words right now and let the senator know how these budget cuts, if they went through, would affect you?
Right. Thank you so much, Diane. You know, yeah, like Diane said, I am Robert Ashby, and I am actually a DDD client myself, actually. And yeah, these cuts for these services would be devastating, because especially with the with employment, because I'm not working right now because of this COVID stuff, because I had to quit my job and stuff. And if you guys cut these services, it'd be devastating, because how am I going to be able to find a job if I don't have those services? Because I would have like the one-on-one support, with my job coach, because my job coach would be there to help me on the job and stuff, and it'd be devastating. So that's why I don't hearing about these services and stuff being cut and stuff is not very good. I don't like when I hear stuff like that's going to happen and stuff. But I definitely do ask, that these the senators, that they find some way, not to cut services, but to find some way to balance the budgets and stuff. And, not just for me, but for other people who are on DDD and stuff, or for the people that want to get on DDD services, because people need these services, because, without these services, it would be disaster, and it would be very disastrous. And plus, I wouldn't be living where I'm at now if I didn't have the services that I'm on now and stuff.
Well, thank you, Robert. And yes, a place to live is a pretty important thing that everybody needs to have.
Yeah, exactly. You got that right.
So thank you for sharing. And Noelle, Senator Billig isn't here yet, but would you like to take a few minutes to address the concerns from Jane and Robert?
Yeah, absolutely. Thank you so much, Jane and Robert, for sharing, and we'd just love to hear from our constituents, and so it's really important that you do share your stories, and so it's just really appreciated. And everything that you're saying is really hitting home. This is just exactly the kind of hard reality that the legislature is facing. I know that Senator Billig has been working constantly with Senator Rolfes, with the governor's office about just how to approach the budget cuts that are coming. And he has mentioned many times the lessons that they have learned from past recession. There's where cuts created more harm than good that was done. There was, I think that was mentioned earlier. And so, you know, that's something that you can't just do cuts across the board, and that's not ideal, and that's not probably the healthiest way to approach budget crisis that they're facing. So, you know, your stories are so impactful, and it's really important that the legislature look at how to protect and keep people whole and safe in their homes and their jobs, and able to, someone said earlier, you know, we want to live the life that we want to live, and that's just such a powerful statement. And so definitely be passing all these stories on to Senator Billig, and know that they're looking at ways to help people live the life that they want to live and that they deserve to live too. So thank you.
Thank you, Noelle. And now I'm going to turn it over to Stacy and Jeremy and try and answer some of the questions that have come up during this time. And if both you and Senator Rolfes would like to stay with us and maybe answer some of those questions that pertain,
Yeah, I'm
we
sure
would really
Senator
appreciate
Rolfes, I'm sure Senator Rolfes will have far more answers than I will, but I will do my best.
So we'll turn it over to Stacy.
Thank you, Diana. And first, I just want to say thank you to all of the constituents who shared their story today. I know that it's kind of nerve-wracking, and you know, not only are you speaking in front of a lot of people in a sense, but now you're on TV and recorded. So it takes a lot of bravery, and I'm just very grateful to each of you. I do want to take a brief moment and just recognize that we continue to be knee-deep in a pandemic, and we're tired in so many ways. Some of us have experienced COVID ourselves. Some of us have lost loved ones to COVID, and we're grieving. People with developmental disabilities are 4 times more likely to be infected with COVID. In our state, we're 3 times more likely to die from COVID. So many people with intellectual and developmental disabilities have underlying conditions, and just around 5,000 people live in group care settings, where the risk is much higher because caregivers are often working more than one job, and they're working in more than one setting. So we're struggling with the isolation. We're faced with loss of jobs, as has been mentioned here, with the loss of routine. So many people with developmental disabilities depend on. I mean, in some ways we think, well, how could it get any worse? And here we are talking about looming historical cuts to services and programs that are really just a lifeline for personal care, for medical care, for crisis care, respite care, and living in the community. So we recognize that you as public servants are going to be making some extremely difficult and courageous decisions in the very near future, and that this is going to be one of the most challenging times to be a legislator. We also recognize that you, Senator Rolfes, and Senator Billig, if he were here, when he's here, that you're on a very powerful committee, that the state budget is the most important piece of legislation that our state leaders really act on. It's a place where we decide where we invest and we don't invest, who we protect. It really reflects our values, and talk is kind of cheap. We just want to make sure that the budget really reflects the values that in our state of Washington we have, which we hope you'll share, is to protect and support people with developmental disabilities. So we're really hoping that you'll address some of the underlying inequities that existed even before COVID-19. We were 41st in the nation in spending for developmental disabilities before the pandemic, serving only the most severely disabled and people who are in crisis. So we were really a system in crisis, and I don't think that's going to change. In fact, it has potential to get even worse now. So my understanding is we face about an $8.8 billion shortfall. We have about $3.5 billion in a rainy day fund. The cuts to developmental disabilities are in the range of about 140 million. And our hope is that if there's any point in history that the word special could apply in a really positive way, it would be that you would see us as special enough to protect us in the rainy day budget with the cuts that are being proposed. We also know that federal funds are really crucial, and they could be coming along to help fill that hole. But we're just wondering, Senator Rolfes, are there questions that you have as you listen to the information provided today? I know that you've noted in the Zoom, in our chat, you're curious about questions around IEPs and supported living programs. So I can give you a brief amount of information about that, and then I'm wondering if you'll just continue to share with us, what do you think is going to be the best approach for our community? Is there a special place that we can land within budget negotiations? Because equal cuts are definitely not equitable cuts in our world. So first I want to address just what's happening with school support and IEPs. And so as you've heard probably even in the last 24 hours, most school districts are deciding for the safety of students to go to online learning. That has not proven effective for most students with disabilities, in particular for students with developmental disabilities who may need access to physical therapy, occupational therapy, speech therapy, who really need more engagement and interaction by an adult. And so we're pretty concerned about what's going to happen with widespread online learning and whether or not there can be a way to look differently at the education for those students to ensure that they're not regressing because they're at greater risk of regression. And to ensure that if there are going to be any ways in which there's a closer touch for students, that it would prioritize our students. At the same time, we certainly hope that as teachers are designing online lessons, they include students with disabilities, and that there'll be some thoughtful ways that that could happen. We know that generally speaking, the CARES money has gone directly to districts. I think I've heard there's about a 20% holdback in those funds, but generally they're going straight to districts. We're just not clear that districts are prepared to plan for our students. And then in terms of supported living, we have done a good job in passing along the CARES money to those providers so that they can stay whole. They can account for the gaps that are happening in staffing. There is quite a shortage still of PPE, but it is getting better. We know that that's critical and essential. One of the things that we're watching for is whether or not at the federal level, home and community-based waivers will be prioritized in the additional federal funding that will happen for COVID, because as our staff are being infected, it's difficult to replace them and make sure that we have good care. And then in caring for someone who is ill directly, to make sure that we can distance and we have sufficient spaces for people to be isolated. So I hope that gives you a little more information based on those. And if you have any questions, just let me know. So I'll turn it over for a minute, Senator Rolfes, if again, you might tackle some of these things that you've heard, or if something strikes you as particularly important, we'd love to hear from you. Oh, you're still on mute.
One of the things that occurs to me listening to you all is as tired as people are, the people who have kids in school right now and advocates for the DD community and kids with special needs really need to be pouring it on and working with the school districts. These budget conversations that we're having, I don't think I think that's not a short term, that's not a problem that needs to be solved this summer. That's something we will continue to discuss throughout the fall, but getting the districts up to speed with how to provide services for the children with IEPs is really, really critical. And the state, I don't know that the legislature, well, I will say legislators don't really have a direct role in that. We sent the school districts the special education funding that they're entitled to, that according to formulas, and they need to be using that funding to the way that we intended it to be spent. And so for the districts where there's not a good plan for special needs kids in an online setting, it's really, really critical to have people working right now with those districts to make sure the kids are getting what they need. And I see the question from Barbara R. This school situation is just horrible. It's horrible for all parents, and it's so disappointing. It's so personally disappointing. And I don't even have kids in school right now, that our infection rates in the state are so bad that we can't educate our kids in September. It's just it's a stain. I think it's just it's a stain on all the adults that we couldn't pull this together for our kids. So this is a big, big challenge for every single family. And I don't know that any of us thought this would be the situation until you know, the last week or two. So the legislators are talking about, how do we provide childcare? How do we provide wraparound services? How do we make sure people can work while their kids are not going to school? It's a crisis across the state. And for parents of kids with special needs and IEPs, it's even a bigger challenge. So however the legislators can help you as representatives of constituents, you should, you know, work with our offices, tell us what you need, but the districts are really in control right now. And it's the districts, some are gonna do it better than others. And I think the ones that do it better are gonna be the ones that have active communities helping them do it better. But stay in touch on this.
Senator Rolfes, thank you so much for raising the question, and thank you to Barbara, who jumped in and perfectly encapsulated the real concerns that many of us are facing with our districts. You know, there's 295 school districts in the state, and so asking parents to individually tackle each of these school districts to get the services that they need for their kids is a monumental feat. And, you know, I say that with personal experience. And so it is helpful to have some guidance from OSPI, Office of Superintendent of Public Instruction, to say, yes, we want to lead with this equity lens and hopefully get to kids who are furthest from educational justice. And that's been great. I guess I would say that, you know, for as many of the larger school districts are coming out and announcing that they're just going to do all online learning until November 2nd, you know, my feedback, both as a parent and from what I'm seeing from other parents struggling with this, is that that's not workable. You know, online learning for kids with disabilities is very difficult for a variety of reasons. It's my understanding that many of these districts have just no plans to provide the services that are guaranteed to kids in their IEP. Tacoma School District, for instance, laid off 2/3 of their paraprofessionals. And you know, I can speak for myself, but I am having a heck of a time trying to get them to understand that my son needs a paraprofessional to be able to access a free and appropriate public education. I experience very few barriers as a parent. I'm well resourced. English is not my first language. And I have the flexibility to be able to, you know, try and help my son access his education, but many parents do not have those resources. They don't have technology to be able to pull this off. Many people in rural areas across our state have shaky internet access. And so I just can't understate the barriers that kids with who need additional supports to be able to access their education are experiencing across the state. And so, you know, I think it would be beneficial and helpful for legislators to take more of a lead or a role in making sure that districts are providing the educational services that are guaranteed to our kiddos under the law. Thanks.
And so I want to address that, and I see Andy is on, and I know people don't like. I know you don't want to hear that. Like, this is a critical time. The legislature doesn't have a legal role, so we have a political role. But we gave the districts money; they have a legal obligation, and we can maybe, as a team here, we can work with OSPI and create a outreach for the districts, but we need to come up, we're going to need to come up with some kind of an action plan, and it has to be in the next week. But I know, Adrian, I know the struggles that parents have, and I can call my superintendents in the districts that I represent and say, hey, make sure you get this done. But that's what I can do. So that is why I raise it, is because I want to make sure people know this is the time. And I think I can say that most legislators are going to want to be and will be willing to be part of the team. But it's now 301 school districts. If you count the charter schools and the tribal schools, there's going to be 301 different ways of doing this. So any specific plan that you all have that we can be part of or lead on, I'm happy to hear it. I don't know what that looks like right now from a legislative standpoint.
Thank you so much, Senator Rolfes. That's great to hear, actually, and it is a great idea, actually, that we reach out to our legislators and maybe at least superintendent by superintendent start to tackle this issue, because it's been clear through OSPI that there's a lot of local control, and as you said, there could be 301 different plans. So we've got to figure out a way to make this more uniform and more fair. And welcome, Senator Billig. We're so glad that you're here. I don't know how long you had a chance to kind of hang out and hear from some of the constituents, or if you've had a chance to look in the chat box. We've just been talking a little bit about what might be your approach to looking at alternatives to cuts to our programs, to your opinions about raising revenue and how that might go. We've mentioned a couple of times, we're hopeful that either the rainy day fund or some amount of conversation from leadership would potentially protect our community, because we were in such a difficult state even before the pandemic happened. I'm wondering if you feel comfortable just saying a few words and maybe introducing yourself to the group here and make a few comments about that.
Yes, I'd be glad to. Thank you. Thanks for the invitation to be with you today. And I've been listening for a little while, and I did review the PowerPoint that you had sent. And also Noel, my legislative assistant, had texted me some updates from earlier in the meeting when I was on a conflicting call. I'm Andy Billig, state senator from the 3rd legislative district, which is Central Spokane. And also I have the honor of serving as the Senate Majority Leader. I think obviously the concern about cuts is something that we see across programs, and the concern is legitimate. I think you're right to be concerned. We are in a very, very significant financial challenging time with a deficit that we don't even know the full extent of yet, but currently at 9 billion as the estimate. But we do have some good news, and I hopefully am not repeating things that Senator Rolfes had said, so I'll be fairly brief, and then I'd be glad to answer any questions. But we do have good news, and that's that we have the rainy day fund, about $3 billion in reserves. That was not the case during the last recession. So that puts us in a much stronger position. We also think that we'll be getting federal funds. We've gotten some that we can use, and we hopefully will be receiving more. And then that's still going to leave a gap, and that gap we're going to close by some combination of budget savings and cuts and potentially new revenue. And hopefully those cuts are not particularly deep, but it is challenging, as you know, because so much of the budget is off limits to cuts. So it just puts a focus on a small number of items that are eligible for cuts. And unfortunately, those items, like the programs that you care about and childcare and higher ed, they're very much things that those are the areas that are exposed, and those are the areas that we need, that were in trouble before, and that we especially need for a robust recovery and safe, continued safety for all of our citizens and prosperity. So it's going to be a challenging time, but I think that there are a lot of ideas on the table. We're trying to be creative. We created in the Senate this special committee on recovery to be able to look for creative ideas so that we just don't repeat what happened in the last recession. But I appreciate the advocacy from the disability community overall, but especially that you're being active right now. And I think Senator Rolfes hit it right on the nose, is that when it comes to schools and cuts as well, but particularly with schools, it is in a lot of ways going to be a political solution. School districts, governor's office, legislators, everybody is experiencing an unprecedented drain on the resources that they oversee, as well as their time. This is nobody's office or agency is set up for a sustained crisis like we're experiencing right now. And so when that happens, the things that are going to keep at the front of the to-do list are going to be the things where there is a lot of advocacy. So I think encourage you to stay active and stay in touch, not just with your legislators, but all of your elected officials, school board, and all the other elected officials that have impacts on the programs that you care about.
Thank you, Senator Billig. Welcome. When I introduced myself earlier, I just wanted to say again, I'm Jeremy Norton-Paul. I'm with the Developmental Disabilities Council. And also thank you, Senator Rolfes, for your comments. There are a couple of great questions that have come through the Q&A box here from some folks. So I'm going to take a crack at looking at a couple of those. And senators, when I ask these questions, they're open to either or both of you to address. And so I'll start with one that I've heard asked several times in different venues, which is, can you help us understand some of the decision-making rules or lines between the legislature and the governor and state agencies around maybe what some cuts or reductions could be made by state agencies themselves, with or without legislative approval? What are some of those cuts or reductions that would have to be made by the legislature, and how does the governor work into that? That's a question we hear a lot, and if you could help us understand how that breakdown is, that'd be very helpful.
Yeah, and I'll take that. It sounds, I think Senator Rolfes and I are tagging, and she's got another Zoom that was scheduled at 11, so she's coming in and she's heading out, so I can handle that one. It's a really good question, and it's confusing in that a lot of times the roles are not, it's not 100% clear, and it's also different depending on whether the legislature is in session or not in session. And then there's also sort of the unofficial and the official roles. So I will say that if the legislature is in session, it's up to the legislature to determine budget cuts and balancing the budget. We're going to have an obligation by the end of this fiscal year, which is hopefully just the end of the session, so that would be April of 2021, to have a balanced budget for the following 2 years at least. We normally do it for 4 years. Sometimes that third and fourth year balancing gets turned off, but we're going to have a balanced budget going forward. And that will be the legislature's responsibility. If the legislature is not in session, then the governor can do sort of official budget cuts, but only across the board. He cannot go in, and he can declare a financial emergency and do across the board cuts. So just say every agency has to cut 10% or 5% or whatever the percent is to get a balanced budget. He can also, that's sort of the official way, he also can do some unofficial things without declaring an emergency, things like a hiring freeze, things like so the legislature appropriates money, and then the executive branch, the governor, and the agencies implement it. So they can slow down their implementation. So they can say, we're authorized with money to create this new program. We're going to hire these 5 people to create that program. We're just going to wait. We're not going to do that right now. We're not saying we're not going to do it, but we're just going to wait and not do that. Well, that just saved that amount of money that was allocated for that for at least some time, or delays it. So sorry if that's a little bit confusing, but there's not a black and white answer. But generally it's across the board versus the legislature can do detailed, surgical, specific cuts.
Thank you, Senator Billig. There's another question that came in that Senator Rolfes briefly addressed in the chat box, but I was hoping that you could weigh in as well. And it has to do with congregate care. And most often when we say congregate care, what we're talking about is residential rehabilitation centers, or RHCs, institutions. And so I want to make sure I get this question right. It says that congregate care settings have never been the first choice for individuals and families. During the budget exercise, it was clear that state departments do not know how to substantially reduce the expensive congregate services they provide, and will remove people from services or reduce community supports when confronted with a budget cut. Are legislative representatives able to shift the mindset around congregate care being necessary with COVID-19 being an ongoing risk? And Senator Rolfes made the excellent point that this is very connected to a conversation that's been happening with the Ruckelshaus group, and now with the ongoing task force around the future of RHCs, and what we've seen as a historic shift, continued shift away from RHCs into community settings. But obviously this pandemic puts it in a new light, which is that congregate settings have an even more substantial risk of harm when there's a virus like this. So we're hoping that you could address that issue.
Yeah, well, and I think that's right, that we are in a shift, in a long-term shift. But the question, I think the original part of your question is, what can legislators do to help change that mindset? Well, I think legislators generally, there's 147 legislators, are in different places on that. And I think there are some that are very strong advocates for the RHCs, and some are very strong advocates to close the RHCs and move all to community care, and then sort of a whole bunch of variations in between those two extremes. So yes, I think legislators can help with that. We often have, again, Senator Rolfes mentioned this, and I just mentioned my last answer, there's sort of these official ways we have influence, and then there's unofficial ways. And so I think we can use our unofficial influence in our discussions with agency directors and the various other people and agencies that we deal with, to let them know what our wishes are. But ultimately, the ultimate hammer comes down to the budget. And I think those types of things, making major changes in the budget, is typically done through an incremental process. And I think that's what we're in the middle of, is an incremental change away from the RHCs. But I don't think it's going to go particularly swiftly, but I think it is moving.
Thank you, Senator Billig. There are many of us involved in this conversation who are not only watching and listening very closely, but are actively involved in those conversations. And so we look forward to seeing continued stakeholder input and movement on that. There's a question that I've heard a couple of times, and we're hoping that you can maybe shed some light on this. We're going back for a minute to the issue around schools, school districts, education funding, and the challenge that students with disabilities and their families are facing when they're not provided supports and services that they need. Are there any ways or considerations around funding being potentially withheld or limited to school districts who are demonstrating an inability to provide those supports and services to students with disabilities? I've heard that a few times, and we're wondering if that's something that the legislature is considering, if there's even a mechanism for that to happen, or what your thoughts in general are on that funding piece.
Yeah, I have not heard that discussion specific to students with disabilities, but I have heard it generally. The concern, the kind of line of thinking is, in the spring, when school districts went remote, there were some districts who did a great job of engaging students, and some districts that didn't do as good a job. And there's just some students that are much harder to engage with. and for a whole variety of reasons. And the districts need to be held accountable to engage with those students. And so one of the ways that could be done is through the definition of attendance, and just sort of the interpretation of the definition of attendance. So the districts get their primary funding based on students being enrolled in schools. So what does enrolled mean when you're doing something completely virtually? Does it mean that you're just offering it? Does it mean that they show up occasionally? Does it mean that they're regularly engaged? And I think it's a little murky, but I think it's the Office of the Superintendent of Public Instruction that will help define that attendance, and the legislature, when we're in session, can help with that as well. But I think we can help the districts to be accountable through that definition, so they know that we're going to have a robust definition of what it means for a student to be attending. And so in the case of a student with disabilities, that means providing services at an adequate level. And if a district can't do that, then that student has not officially attended, and then they wouldn't receive the funding for that student. And I think that will create a financial accountability for the districts to engage with, to do everything they can to engage with students. And look, this is really challenging. So, it's going to be hard for the district. So we want to not be punitive, because we want the districts to do the right thing, but we also want them to have motivation and hold them accountable. So we're going to work on getting that balance exactly right. I've already had some discussions with the Superintendent of Public Instruction about that, and hopefully that accountability will be there.
Senator Billig, thank you so much for that answer. Just a quick follow-up to that. With the special education multiplier, which is supposed to help augment the basic education funding for students with disabilities, do you foresee a mechanism in which, if students are not being served by the schools for a variety of reasons, that at least that multiplier portion of the funding can be withheld, or at least redirected to private schools where the students would go, or what have you?
I think redirecting it would be hard, especially without a legislative session. And I don't know the mechanics of that. I would need to, and how that would tie in specifically with attendance. So I would need to do a little more research on how that might specific to the multiplier.
Thank you, Senator Billig. And this is Stacy Dim. I'm the executive director at the ARC of Washington State. I didn't get to introduce myself to you before you came on. We've tried really hard to make this 6-week session bipartisan, inviting both Republican and Democrat leaders and budget legislators. And we've heard from a couple of the Republican legislators when they've been on. They want to work together. They want to make this a bipartisan effort. And they always end, it seems, with a quick note, but that the Democrats are in charge right now. And we look to you for a lot of leadership, and we're curious from you, and I wish Senator Rolfes was here to answer this question too. Do you have ideas for how to reach across the aisle so that the solutions really are bipartisan? Senator Rolfes noted that in the developmental disabilities community in particular, there's been very good bipartisan support and protection of our community. So I'm just curious if you have any comments about that and suggestions for us.
Yeah, I mean, I think the the advocacy community for disability rights has done a good job of keeping things bipartisan, and it's good because it's not identified as a partisan issue. But I think what is partisan is the funding, and the way that we're going to avoid cuts is through getting creative on revenue, and there's a real partisan divide there. And so, I mean, that would be an area, that's probably the biggest area where we can use help to make sure that we don't have to do cuts either across the board or just cut the things that are not protected by the Constitution. And so that's one area. I think the other thing that you can do, which you have done, is just keep fostering that, asking questions like you just asked, ask legislators to work together when you have bills that you're that you're working on and you're going to propose, always make sure that you not just ask a Republican and a Democrat, but see if you can get them together so that they will actually sponsor the bill as a team. I think a lot of people just worry about getting the first signature and the second signature, but if you could get it where it's actually a team, that you're doing this together, it's just a different mindset for the legislators. And I think that's a really good way to stay bipartisan. And then, you know, the last thing I'll say is that while, you know, I think there's sometimes a perception that things are very partisan in Olympia, and we're in an election time, so it feels a little more partisan right now. But the secret of Olympia is that actually most of what we do is bipartisan. And it's really refreshing. It was one of the surprising things when I got there, was that, you know, 90% of what we do is bipartisan, and a lot of it's unanimous. And even when we don't always agree, we usually still work together on amendments or trying to work it out, trying to incorporate ideas. So there is a lot of opportunity to work together and a lot of opportunity to be bipartisan.
Thank you so much. We really appreciate that. And we're so grateful that you came on after your important call and that you were able to step in. We really, really appreciate your presence. We'll be in touch. We have a few more questions that we might share with you offline from this conversation. But now I'm going to turn it over to Diana so that we can talk about ways that our community can really get involved in advocacy.
Great. Thank you so much.
So what we're looking at now is we've heard from Senator Rolfes and Senator Billig and gotten their ideas on some of the things they think could be addressed. And now we want to give you some avenues to do that. So we're going to go over a few things that are action things that you can do now and give you some ideas that when you leave this webinar today, that you'll have some marching orders, kind of. So let's talk about some of those things that we would like to see happen. First, we have the ARC has an action center, and in that action center, there's several things that you can do. First of all, you can join the action center, and then you'll get email alerts or text alerts, whatever you choose, that lets you know there's some action that needs to be taken on an issue. So right now, this is what showed before yesterday. We had an alert and a petition to the governor about the budget cuts. And so you could go into either one of these. It gives you a little explanation of what's going on and what needs to happen. And then you just put it, you can write in your information, a story of your own about the situation, and click send, and off it goes to your legislators or to the governor. We did have a third one that just got put in yesterday. It's a federal one, and this is about the federal stimulus. It's called the HEROES Act, and they would provide funding for Medicaid services. And for us, most of all of our services are Medicaid services. So it would greatly help our state to get that extra matching of funds from them. But we also have an advocacy toolkit that the Developmental Disabilities Council put together, and Adrian's going to talk to you about that.
Can you hear me? Okay. Hi, everyone. So again, I'm Adrian with the Developmental Disabilities Council. I'm really passionate about eliminating barriers for all of us to help educate our policymakers at every level, school board members, legislators, you name it. So we've created this toolkit to try and make things really accessible for you to, and in order for each of us to participate in a way that we can. So some folks are not able to read, some folks aren't able to type an email, some folks do better just calling a legislator or a legislative aide and telling their story and explaining the problem or the situation in their own words. So this advocacy toolkit lives on the DDC website. There is my contact information is here. Please feel free to reach out if you have any troubles or questions with this resource, but we provide 3 kind of buckets for you to choose from. And the first bucket, as you'll see, is a social media bucket. There's links to videos in there that should work for you. And there's hyperlink, click on the hyperlink and videos will come up. And examples for Facebook posts. In the second bucket are some messaging ideas that you can create, use that as a template, and then create for yourself, pop in your own story and talk about how these proposed cuts could impact you. And then the third is that bucket of outreach templates, emails and letters that folks can use, phone scripts, etc. This isn't just for legislative advocacy. It's a great way to help to use this. It's a great time to use this tool when you're talking to your school districts, for instance. So please use this toolkit in a way that works for you, and please let me know how I can help reduce the barriers for you and your family to tell your story to policymakers. Thanks so much.
Thank you. And now we're going to have Jessica talk a little bit about some things you could do.
The same format for them all. You just need to know their first and last name, which you can also find on the legislative website.
Thank you, Jessica. I think a little bit of that got cut off there at the beginning, but there is a district finder on the legislative website. And all you have to do is put in your address and it will tell you which legislative district you live in and who your legislators are. So we've got social media nowadays. This is very big. Many people are on Facebook, Twitter, YouTube. Those are areas that you can share your concerns on about the budget cuts or any other legislative issue that comes up. And the advocacy toolkit gave you a little bit of ideas of how you could do that, both on social media, email, whatever you may use for your medium. So you've heard a lot of different ideas of ways that you could act and do something right now that could make a difference. Legislators are not in session, but they still need to hear from you. So we're going to do another poll here. Let me change it to this one. Okay. So now that you've heard some of these ideas that you could use to contact your legislators and let them know, what things do you think you could commit to doing this week? We've got the action alert, and actually there's 2 of them, the state one and the federal one. Signing a petition, using the DD Advocacy Toolkit, posting things on social media, calling or emailing your legislators. And there are advocacy groups like self-advocate groups that focus, like Self-Advocates and Leadership, SAIL. Their focus is on legislative advocacy, and they meet every month and sometimes more often. And there are parent coalitions around the state too that you could reach out to if you're a parent and get support and help with advocating through them as well. So it looks like most people have responded now at this point. So it looks like the DD Advocacy Toolkit and calling your legislator, those are the things that touched off in most people's mind the most this morning. And the action alerts, the petition, and social media, which a lot of people are on as well. So I'm glad that people were committing to do something. It's so important, and it's just something that can't be emphasized enough, that you can be the one to make a difference. One person can make change happen, but it doesn't happen unless you show up and do things. We also will have an evaluation by email that will be coming out to you, and we'd appreciate it if you'd fill out the evaluation and let us know how you think we did with these virtual advocacy days. We have done 4 of them now. We have 2 more left the next 2 Thursdays, and we hope that you will join us again for them then. So thank you to everybody who joined us, and we look forward to seeing you next week.